Hi, my name is Charlie. I'm Pinoy nurse here in the UK. For today's video, we will be talking about a nurse's daily routine in a nursing home. Now, it's been a while since I've made a video, and I do have my reasons for that, but I'm not going to tell you all about them in this video though. Anyways, on to our content. Now, as a nurse who works in a nursing home, if you compare your routine with someone who works in a hospital, yours would be more or less variable because you know what to expect. As long as you develop a routine, you know what to expect, and it's there's less changes in that routine compared to someone who works in a ward in a hospital. So in this video, what I've done is I've listed down my routine or what I used to do when I was still working in a nursing home. Okay, the first one is, of course, as soon as you get to the nursing home, you do the handover. If you're doing the morning shift, because I'm going to talk about the morning shift, because the night shift is an entirely different beast. In the nursing home where I used to work, what we did was we would go around the nursing home into or right in front of the door of our residents so that we can see how they are, and if they are awake we can say hi, good morning, how are you, and we can see how the state of the room is, how the state of the patient or the resident is, so that everything that the night nurse hands over to us we can see. If he says that the resident is on the turned on the left side, we can verify that the patient is turned on the left side. If the patient is on the chair, we can see that it's on the chair. If there are new items in the patient's room, we can see, and the nurse handing over can just point it out to us and we can see. It's a good way of doing a handover because you, as the receiving nurse, can verify things that are being handed over to you. So if there are any changes in a patient or in the resident, you can immediately see what those are. Now, the handover may take 15 minutes or 30 minutes depending on the day or depending on the residents or depending on the person doing the handover. Alright, so just to let you know, my camera's battery was drained, so I had to do this over again. And so number 2 on my list is doing the quick huddle. So this happens right after you do the handover. So on the quick huddle, what you do is you get the team together. If you are getting someone new, this of course the chance for you to introduce yourself. So let's say, for example, you're getting an agency for today's shift. So this is a good chance to introduce the rest of the team to that agency so that everybody's aware of their names, each other's names. So yeah, that's really important. And as well, you take this time to allocate or pair up everybody, because there will be residents in your nursing home who are doubles. They need doubles. They need 2 people to help them out with their personal needs and everything else. Oh, and I'm doing the laundry. Let me just pause that. Alright, anyways, like I said, so there will be residents who will be doing, who will be needing 2 people to help them out with everything. Let's say, for example, people who need hoisting, and no, don't worry about these because you will receive MNH, mobility and handling. What was it? Mobility. What's the M stands for again? I forgot, but yeah, manual handling. There you go, manual handling. So you will be getting training for this, and you will be taught how to use a hoist if you haven't used one before. Now, going back to the point, yeah, you will have to pair up certain HCAs so they can work together to help out residents. Now, you may, your nursing home may have a team lead or a senior HCA, so sometimes this responsibility is delegated to them so that they take care of these things. All you have to worry about is relaying new information, relaying concerns, things that need to be done throughout the day. Let's say, for example, is we have this thing called a resident of the day, wherein
for that day, it's the day for that resident. So usually we weigh that person so that we can update the must score. We also update all the other care plans if there has been any changes. Does the patient need crutches now? Zimmer frame? Do they need rollators now? Are they for hoisting, or are they able to mobilize on their own now? So these things need to be updated. If the patient needs bed rails when on bed, we need to update that in the care plan as well. What else? What dressings are needed for his or her wound, if he has any? Has there been any progress, any changes? Is it healing well? Is it not healing? Is it getting worse? Is the person under antibiotic? Has he or she been prescribed new medications? Is the risperidone increased? Has he been off lorazepam? Is what else do they get usually? How often does he get paracetamol? Is it every 4 hours, every 6 hours? Is it PRN now? All these you need to know. When was the long-term catheter replaced? How many days do we still have left before it needs to be replaced? I got a bit off topic there, but that is an important bit of information. So quick huddle. Sorry about that. Quick huddle. I've said about the highlights, any concerns, any changes, any updates on local policies, your guidelines. These need to be relayed to HCAs. Let's say, for example, if there has been a concern from the previous shift and we need to correct that today, then we need to let them know. Okay. So that is your quick huddle, and we're only in the second step or second part of my routine. Okay, so the first one was the handover, second one was the quick huddle, and the discussion was not so quick. So the third thing on the routine, on my routine when I was still working in the nursing home, is the morning meds. Now this usually comes together with the breakfast. So while you are doing the morning meds, your HCAs will be with the residents, helping them out from their rooms into the communal not kitchen, but the dining hall. So the HCAs will be taking them out of their rooms. If they're in a wheelchair, they wheel them out. If they are in a push chair, of course they wheel them out. But some of the residents are able to mobilize them by themselves. So others just need assistance to go to the dining hall. So while they're doing that, you will obviously be preparing your morning medications. Now, with your morning medications, it differs significantly depending on which pharmacy your nursing home uses. Some nursing homes use the pharmacy that has blister packs. So each day you get morning, lunch, evening, and night medications. So all you have to do is to pop the blister for that particular time and give it to the resident. Another pharmacy uses just the regular boxes wherein the medicines are in the regular how should I say that? I don't know what I call them, but in regular the regular medicine you would see from a normal pharmacy. So in this case, you would have to count each tablet or each pill in that box or bottle. Because we do in my previous nursing home, we have the 28-day cycle. What you want to do is you want to have an exact number to last the resident for the entire 28 days. So for this pharmacy, if your nursing home is using this particular pharmacy, you will have to count each and every one of those pills every time you give the medicine. So if you have, let's just say, ferrous sulfate to last for 28 days, so you have 28 tablets of ferrous sulfate. So each time you give ferrous sulfate, you have to count each one. So the first day, obviously you'd still have to have 27 tablets left on for that cycle. So you sign that, and you make sure that you still have 27. Some nursing homes write down the actual number in their drug charts. Others, they just make sure that they have enough. On the previous nursing home where I used to work, if you don't have enough medication, you write an AR. You explain why you're missing you're missing medication. So it's really, in nursing homes, documentation is really important. It's a big issue for them if you are missing medications. Paracetamol, it's a big issue for well, at least for the nursing home where I used to work in. So yeah, you really have to count. But if you are using the blister pack, you don't have to do that because they are already pre-packed together. So all you have to do is pop the blister pack and you're good to go. For breakfast, well, if you're done with your medications and you see that your HCAs are still doing the breakfast, you can help out with this. When I was starting out in the nursing home, I was not comfortable helping out the elderly with their meals, especially those who have swallowing problems. I was a bit scared, to be honest with you, but I got used to it. You just have to follow the guidance from the SALT. So the speech and language therapist assesses a resident and decides what kind of foods that resident can eat. So depending on their assessment, could be a level 1, 2, 3, 4, 5, 6, 7. Here in the UK, the level for fluids and for food are different. For fluids, if it's a level, if it's a level 1, you add a thickener for that resident. 1 scoop of thickener, that's level 1. Level 0 is thin fluids, you don't need to put any thickener there. Level 1, 2, 3. I'm not sure how far it goes up, but yeah, all you have to do is to add thickener. Level 1, that's 1 scoop. Level 2, 2 scoops for each. I think it was 220 mils for each scoop. Next, after your morning meds and breakfast, you usually have your activities as well. And now there is a separate team that handles this, that manages the activities. In our nursing home, there were 2 people managing the activities, so that really depends on what they want to do, what they got planned out for that day. They might do some, let's say, flower arranging, drawing, painting. They might go on a trip outside, field trip. They might go to the church. They might go on a picnic. They might go visit a museum or something, or concert maybe. Sometimes volunteers come in and do activities. Other times they hire external performers to come in and do songs, dance, choir. The church, they sometimes come in as well. And bingo. A lot of people like bingo. So you can join them as long as you got the time, especially with these quizzes. Sometimes the family joins in as well. Another thing, and this does not happen on a daily basis, on our nursing home, it happens weekly. I think it was, if I remember correctly, it was a Thursday. So every Thursday the GP comes in the nursing home and sees whoever we need them to see. So in order for you to prepare for that day, usually whoever is unwell or needs to be seen by the doctor, we prepare them as early as Monday or Tuesday, so that by Wednesday we would already have a complete list. And if we would need to add a name into that list by Thursday, we do so. All we have to do back then was write down on a form the name of the resident who needs to be seen by the GP and its symptoms or the concerns that we have for that resident, so that by Thursday the GP comes in, he or she would already have the list. If needed, take the medication chart and photocopy it and along with the form of the patient. Or when I say form, the folder that you've got, the records for the patient, because you will be keeping that in the nursing home. You would have access to that, and the doctor may need access to it as well, because they may need to check on the other healthcare professionals who's been seeing that particular resident. It may take about 15, half an hour, sometimes an hour. That really depends. And it doesn't necessarily have to be once a week. If the GP needs to see a resident urgently, you can request for the GP to come in the nursing home and see that particular resident. When would that be necessary? When, let's say for example, you suspect infection for your resident, a lot of the older folks, they really get confused when they have infection. So that's that. Just to quickly recap, we've got the handover, the quick huddle, you've got your morning medications, you've got your breakfast as well, you've got your activities, and the doctor's rounds that happen once a week or as needed. Okay, and for depending on the home you work in, your home manager may require you to have a daily meeting with the rest of the team. In a particular time of the day, you would have this meeting. So a home manager gets everyone in the room and then just do a quick meeting just to update him and the rest of the team about what's happening with the residents, anything that's changing or any changes in the home. That depends. Again, your nursing home may or may not have that. So for us, it lasts about an hour. Next one, after that, you would now have your lunch medication. So just like what you did in the morning meds, lunch meds, same. If you're required to count all the tablets each time you give one, you do so. After your lunch meds, comes in other activities, so more activities for the residents. Those who were not able to attend the morning activities may do so on the post-lunch activities. During this time as well, after lunch, is when you get people or residents going back to their rooms. For those who have not been washed in the morning, those who need pad changes, they do that. The HCAs do that during this time usually. Some of the residents go back so because they're tired. They want to go back and rest, a siesta, matutulog yung mga yan. During this time as well, some visitors may come in. Others come in the morning. There's really no specific schedule for this, but from what I've found, it's usually they start coming in at lunch, washing, pad change. Some get tired, the visitors. If you got any dressing changes that you may need to do, as I found in the nursing home, it's one of the procedures that I used to do often back when I was still in the nursing home, the dressing changes. And order medications. You may start ordering the medications now, or anything that you're missing, you can do so at this hour, because by morning you'd be pretty busy with the morning meds, breakfast, phone calls, etc. If you got time later post lunch, then you may do more calls, ordering medications, ordering any stocks that you may need, ordering what else, dressings, anything. Like if you want to book a transport for an appointment, an outpatient appointment for one of your residents this coming week, then do so at this hour or at this time period. Visits from other healthcare professionals, you may have this as well during the lunch to evening period. But they may come in as early as after breakfast as well. That really depends on their availability. There's no specific time for them. So you as a nurse in a nursing home may see district nurses coming in for dressings. If it will not be you doing the dressing. If it's a specialized dressing, let's just say if your patient has just had an operation, a surgery, let's just say an amputation or knee replacement, district nurse may come in and check the wound, how it's healing, and change the dressing for that wound. Um, you may see the palliative team, because you get a lot of end of life or residents or people who are under the palliative team, so you will see them often as well. Physios, you will see physios too. You will also see people from the psych team, because you do get a lot of people who have depression, Alzheimer's, dementia, people who got cognitive and personality problems. And yeah, so you will be seeing a lot of people from the psych team to adjust medications like risperidone, lorazepam, things like that. Dental team, opticians, diabetic team, you will be seeing them, because most of your patients will not be able to go out, because they won't have the endurance, the vitality to go out and do an outpatient appointment. So usually the healthcare professionals go to them. So you will be seeing a lot, especially when you're doing a morning shift or a day shift. Because mostly for nursing homes, it's 12-hour shifts. Okay, so again, quick recap kasi medyo mahaba na yung pagdadada ko. Handover, quick huddle, morning meds, and breakfast. They go hand in hand sometimes, usually. Activities, doctor's rounds, once a week. Your home meeting if you have it. Lunch meds, and then other activities that you need to do, miscellaneous activities that you need to do throughout the day. After that, evening meds usually around 6 p.m. Yung morning meds mo around 7 to 8. Lunch meds 12-1. Evening meds around 6 p.m. Okay, evening meds yan. Evening meds, of course, they would come hand in hand with your supper as well. And then after that, make sure you finish up with your notes, your documentation. Now, in the nursing home where I used to work in, yung documentation namin, like forms and forms and forms and forms and forms. Like, you can't even with these forms. Back then, for each resident, you get a folder just outside the rooms. So in these folders, you get different forms. You get a form for the turnaround sheet, you get a form for the food chart, you get a form for the fluid chart, you get a form for the activities, you get a form for behavioral chart. If you're having problems with the resident's behavior, if it's being monitored by the site team, you get that as well. You may also get continence chart if the medical team is assessing or monitoring if that patient is continent or not, because you also need that in order for you to order the pads, how much pad that person is using throughout the day. You also get a chart for what else? Any like untoward behavior. I always said that behavioral chart. Yeah, you get all sorts of charts in the nursing home. So you do have this in a folder, and then you also have your nursing notes. So that's when you write down anything that's happened throughout the day, any changes, any updates, concerns, anything good. You write it down. It's more like a story that's happened throughout your day, really, unlike the documentation you would have in a ward or in a hospital setting, in an acute setting. In a nursing home, it's more like storytelling. Because really, what else would you have to document, right? So yeah, so after evening meds, supper, you do your notes and documentation. Actually, with your documentation, you do this throughout or as you go through your day, because you cannot, you need to have them updated, because the nursing home does require you, each time you have or you do a procedure, let's say for example, when you turn the patient, as soon as you turn the patient, you need to document that you turned it, or you turned the patient from the left side to the right. You document it as soon as you do that. If you don't, because some of my HCAs used to do them by the end of the day, and the home manager didn't like that. So what they're requiring us to do back then is, as you go through the day, you need to document, or at least start up with your documentation. So that's the ideal way of documenting. Okay, now that that's done, you now go to handover. Of course, you need to hand over to the night shift as well. As the night shift handed over to you, you do the same. So you go around. Sometimes the residents have already gone back to their rooms. Others would still be roaming around, especially those with dementia who are sundowning. They'd still be roaming around in the evening as you do your handover. So you'd be like chasing them as you do the handover. Telling them where the patient is. I don't know. He might be in the bathroom. He might have absconded. I don't really know. No, don't do that. You need to know where your residents are. Well, anyways, and yeah, the handover. In a handover, you need to make sure that you hand over what the patient did throughout the day, any concerns that you may have, anything that needs following up with. Let's say anything that you need to highlight, say dressing. Oh, I forgot to change the dressing, I didn't have time. Please do so tonight. Or tomorrow this resident will have an outpatient appointment. Make sure that he or she is ready before 8, because that's when the transport comes in.
Yeah, so see that is me editing and finding out that the last part of my video has been cut for some reason. It's my stupid camera. It's probably me. Yeah, it's probably me. But anyways, oh my gosh, my video is very, very long. Yet again, always a problem for me, because I never want my videos to go longer than I need them to. But I try to make long videos. Anyways, I'm not gonna make this any longer. So I just want to thank Paradigm Traveler for giving me this idea of making this specific video. So thank you, Paradigm Traveler. And now, going back to the content, once you're done with the handover, once you're done handing over to the night staff, the next thing you're gonna do now is to run run home. Free wheelie ka na. Okay, so that is basically the entirety of the video. Thank you so much for watching up to this point. Again, this has been Charwin, Pinoy Nurse here in the UK.